Good morning, Houston, and welcome to Feeling Better Naturally with Dr. John Trowbridge, here on Star 790 KBME for the best medical updates ever. Each Saturday from 6 to 7 a.m., we'll share with you practical preventive medicine, steps that you can take starting right away to regain and maintain better health. Each week, we'll update you on books you need to read, whether those written by me or by one of my many friends on what's called complementary or integrative medicine. We'll update you on what you need to know to stay healthier today, and we'll share interviews with patients and with experts. So get your pen and paper ready now so you won't miss ideas that you want to remember. We'll be talking about what you can do to get out of your pain and get on with your life. I've researched and practiced here in Metro Houston for 25 years, never believing that you're suffering from a deficiency of one or more drugs or that an operation is the best answer. Whatever ails you, God built your system to repair itself and to restore more normal function. And that, in a nutshell, is the whole buzz on the topic of alternative or holistic medicine that you've been hearing about these past few years. Drugs and surgery can be helpful, but true natural healing depends on three factors. First, find what's blocking you from feeling better and remove it. Second, find what trace factors you might be missing but you need for repair and provide them. And third, find what switches need to be turned on and then turn them on. We'll share practical pointers to help you improve with the most common problems seen in doctors' offices. Practical preventive medicine updates to help reduce your risk factors for the most serious diseases that claim our comfort and then our lives. And practical ways to reduce your risks and improve your results with drugs and surgery that you might need. As I've said for years, when life is your choice, failure is not an option. So learn more today on how you can succeed. The book of Ecclesiastes tells us in chapter 1, verse 9, that there is no new thing under the sun. So let's see what we might learn from those who've walked the path ahead of us. The famous author and preacher Norman Vincent Peale said, "Any fact facing us is not as important as our attitude toward it, for that determines our success or failure. The way you think about a fact may defeat you before you ever do anything about it. You are overcome by the fact because you think you are." Now, you remember he wrote The Power of Positive Thinking and a number of other wonderful books and tapes that really deal with how we look at our lives, whether the glass that we see is half empty or half full, and indeed the facts that we share on these radio shows and in the books that I've written and in talking with people around the country and in our offices. These facts are the ones that we're simply reporting that share with you how the world really works on the inside of you, what it takes to stay healthy because of understanding how it is that we get sick. And knowing those facts, you now then have the choice of how you think about them and whether they motivate you to action. Rodney from Pasadena wrote to ask me to prove to him that sports injuries can be fixed without surgery. And, our point is that we don't have any proof for that because, indeed, things can be or can't be fixed. We don't know. Each patient is different. Each injury is different. And, indeed, there are patients where we've fixed some problems in one area and similar problems in another we've referred on for other treatment because that's what's right. So let's explain a little bit about how people get in trouble with sports injuries. And, of course, that leads to an understanding of arthritis and low back pain and neck pain and headaches. And mostly regular medical care has been based on a misunderstanding that anti-inflammatory drugs and cortisone and surgery are the only options, besides, of course, learning to live with it. Yet common sense can show you how your condition might respond better than you ever hoped, and you do owe it to your family to find out more, to find out how you should think about these facts. Your body frame is made of bones and bands, the rubber bands that hold you together and give strength to your structure. And when your joints are strong and stable, you can count on your body to function as intended. And when you function well, like when you were younger, you are at ease with your daily activities. You bend and reach and walk without any problems. But any injury can stretch or tear the ligament bands and the muscle tendons that hold your bones in place and allow them to move correctly. But then that instability, as they are stretched or torn, begins as a slight wobble. And over time, an unstable wobble wears down your joints, and we call that arthritis, and degenerates the discs in your neck and back. As your joints weaken with injury, you gradually lose strength and decline in function. You become less and less at ease, which is the slow beginning of dis-ease. Following this idea, you can see how you start to suffer with various symptoms. Now, those are joint pains and muscle spasms, headaches, stiffness, swelling, numbness, even nerve pains. You lose sleep, you become irritable, and of course you suffer with limitations. Now, you can see how these symptoms would motivate you to reach for the relief on pharmacy shelves or at the prescription counter. Perhaps your symptoms are severe enough or last long enough that you choose to have surgery. But none of these treatments aim at the cause of the injury pain, which started as the wobble in the joints that weakens the rubber bands holding your bones together and just generally wears you down in a grinding motion. Indeed, aspirin and ibuprofen and cortisone will stop your repair by blocking injury inflammation, which is always the first step in healing. So the drugs that we reach for comfort are the ones that keep us from ever repairing and getting better. Surgery can actually weaken you by removing parts that your body counted on for its strength. And finally, you worsen to the point of crisis, where stronger drugs and bigger operations seem to be your only choices. You first start with perhaps just a scope and scrape operation, and then finally we're talking about major joint replacement. And remember, when they talk about joint replacement, you really don't get a new back or a new knee. You just get new steel and new plastic. At some point, side effects from medications, such as bleeding ulcers from the common drugs that are used, or surgical limitations can severely restrict your choices. Fusion surgery places greater stresses on the discs above and below, which means they too begin to wobble more and degenerate faster, which leads again to another operation for fusion. And rather than conventional treatment starting at symptoms, wouldn't it be nice instead to direct the treatment to the area where you actually started getting in trouble, the rubber bands that got torn and stretched? And that is an alternative medical solution called reconstructive therapy, or RT for short. Reconstructive therapy, not surgery. It's orthopedic medicine instead of orthopedic surgery. Now, this non-surgical treatment is aimed at the top where the problems start, rather than at the bottom where the problems are limiting and destroying your life. In other words, the top where your ligaments and your tendons have been torn or stretched, and therefore you started getting the wobble in your joints. And if we correct that wobble, that stops the painful problems. RT, the reconstructive therapy, is a treatment that stimulates natural healing processes, and that's by placing fluid into the support bands around the injured joints, the ones that have been torn and stretched. Your body responds to these tiny injections by making new tissue, giving you more strength, improving your function, and restoring your ease, restoring the way you should feel. And that makes sense. So, do you hope for lasting relief? Are you looking for alternatives to daily drugs or surgery? Do you fear other limiting future problems, worsening low back pains or neck pains, dull headaches, stress, just waking up not ready to face the day, or muscle spasms that constantly bother you, joints hurting sometimes at the most unpredictable times, and giving you the idea that you shouldn't be doing things in your life because you just don't know when you're going to be hurting or irritable? Unfortunately, many physicians don't know about this medical alternative, this reconstructive therapy, and can be skeptical when they hear about RT. And many of our patients have said, oh, well, he's injecting cortisone, he's using steroids. That's the same thing, incidentally. When they tell you they're not using one, they're using the other, they're the same thing. But as with many treatments that were later found to work surprisingly well for other problems, this one is one of those that's going to eventually begin to be recognized simply because it brings about results. The treatment doesn't involve cortisone or arthritis or pain drugs, and as with all treatments, individual results will vary, and no doctor can guarantee to help with any specific problem. So sorry, Rodney, the deal is we can't tell you that sports injuries have to get better, but we sure see the success. RT has been chosen by champions to get back to baseball and water skiing, handball and golf. Most people get results in as few as 12 to 24 treatments and enjoy life, work, family, and sports more. And it's not too late for you to find out whether your arthritis or other pains or sports injuries might find relief with RT by treating the real cause of your problems. It's about 10 past the hour, and you're listening to Feeling Better Naturally with Dr. John Trowbridge on Star 790 KBME, the best medical updates ever. Your extended health forecast is brought to you now by Life Celebrating Health in Humble, near Bush Intercontinental Airport. Our crystal ball shows clear to partly cloudy, with the winds of change blowing. If you're choosing to make changes to regain and maintain better health, sunny skies are coming your way. If you don't know what you can do, or if you're not changing anything and simply hoping for the best because you've been feeling good, no problems, then partly cloudy to stormy skies are on your horizon. At Life Celebrating Health, you can depend on us as partners in your healthcare, and we'll design personalized programs to help keep your days sunny. And we'll show you how to spend less and get more. Call for a telephone consultation with one of our treatment assistants. No fee, no obligation. Just dial 1-800-FIX-PAIN. That's 1-800-FIX-PAIN. 1-800-FIX-PAIN. Ask to receive our free e-newsletter. Just share with us your email address or send your questions to us through our internet website, www.healthchoicesnow.com, because unlike the weather, you do have choices for better health. Now, Sharon from Alvin called and said, can you explain just why we claim that the majority of our patients get better and stay better when treated for sports injuries and arthritis? So we're joined today by Dr. Bill Faber from Milwaukee, Wisconsin, the author of Pain, Pain, Go Away, and Instant Pain Relief, and the co-author with me of Do What You Want to Do. Dr. Faber not only trained me in these wonderful treatments of reconstructive therapy and neurofascial therapy, but he also treats me. He is my doctor. So I'm pleased to present to you my friend, Dr. Bill.
Hi, John. Great to be on your show today.
Thank you, sir. I appreciate you joining us this morning. You know, when we talk about getting people better, the stories that you and I trade, you know, when we're talking shop, sound absolutely incredible, but they're real.
Well, absolutely. As we've both been through it, I'd like to mention that Dr. Trowbridge is my doctor. In fact, I just took some of his prescribed remedies specific for me and where I want to be with my health. And he's applied the technology we're going to talk about to my spine many times with excellent results.
No, both of us have continued to improve in our health over the years rather than worsening.
Yes, and that's what doing the type of topics that you talk about on your show is so exciting about. Instead of maintaining or trying to maintain, we expect our patients to be in permanently better positions.
You know, that's an interesting concept when you say permanently, because I get patients who ask all the time, well, you know, do you have to keep doing this in the future? And I say, you know, for most people, it's just like with a scar from an operation. You don't go back in 5 years and say to the surgeon, do you think you need to tighten this up? No, it's healing.
Correct. For most people, the results are permanent. For the small percentage of people that we recommend long-term care, they have reached permanent levels of, you might say, betterness or wellness, increased function and decreased pain or freedom from pain. But because they have such massive defects, deformities, surgery, or degeneration, we recommend for a small percentage of people, actually less than 5% in my estimate, that they get some long-term care.
I would agree with you about that, less than 5%. But then again, I'm one of those. I have a genetic defect that you well turned me onto called ligament laxity syndrome or hypermobility syndrome. And so I'm one of these folks who has literally torn myself up and had 2 neck operations and a low back operation. And I found the best relief ever with reconstructive therapy.
Right, but you also found that manipulative therapy and nutritional therapies were of benefit.
Oh, gosh, yes. Chiropractic care has helped me immensely, and osteopathic adjustments and nutritional support. No question about that. But when it came to really holding me stable and stopping the wobble, that's the reconstructive therapy that you've done on me.
Well, what I tell people every day, and I know you do, is that once you get a critical amount of treatments, usually somewhere before 12, and that's what I call phase 1, and that's that certainty of improvement, is that I think that probably the number one sensation that most of us get is that we have an internal feeling of strength and stability within the body part that's being treated that we never have received with osteopathy, chiropractic, nutritional, other body therapies. Nothing else does that for us like reconstructive therapy.
Yeah, nothing else settled it in just right like that, where you start feeling more normal.
Well, you feel like both of us, we both had I had my first reconstructive therapy at 33. You had yours at, how old were you when you had your first therapy?
Oh, gosh, I think it was 42.
Okay. When your second daughter was a baby, wasn't it?
Right.
Okay.
She was 20 pounds, dripping wet, almost 2 years old, and I couldn't pick her up without shooting pains down through my toes.
Right. So you had 42. You had 20-plus years of pain and misery, and I had 15 years of different levels of pain and misery.
Right.
And so, but it all changed for us after we received our first reconstructive treatments. I could tell with my very first one.
Absolutely. You know, after my first one with you, I never wore my back braces again. I actually discovered them in my closet years later and said, oh, I forgot about these.
You're the only patient ever told me that they wore two back braces, one on top of the other.
That's right. It provided enough stability for me to be able to work, and I wasn't bashful. I wore them outside my clothes and put an ice pack in between them.
Goodness.
And that's how I was able to keep working, because I didn't want to take the medications. I mean, that wasn't helping me, and that's not a service to anybody.
You know, why don't we talk about something that, we both saw a number of different practitioners before we started getting levels of relief.
Right.
But why don't we talk about symptoms that are so common to spinal instability, spinal weakness, that you can tell 99.9% of practitioners, and it doesn't mean anything to them, but it means the world to us.
Right.
And I'm going to start with the first symptom that people with spinal instability have, and you can jump in after that, and we'll kind of go back and forth. But over 90% of people have the symptom of they need to change positions constantly.
Right.
If they're sitting, they need to stand. If they're stand, they need to sit. They do better with where they have a position where they can move, even if it's a job where they can move frequently. They don't have to be in the same position. Such as walking is generally easier than sitting or standing or writing. And this is because their primary stabilizers, their ligaments, are not holding. They've been stretched out, they've been torn, they've been cut out, they become lax through degenerative disease, and they're not holding the person up. And in time, that instability puts a pull on nerves, a stretch on nerves. They hate to be stretched. And I'll go through the second common symptom, because after I go through the history of patients, I'll say, let me tell you how your symptoms are.
Exactly.
And you tell me if I did a better job of describing your symptoms, how I think they are, and you tell me if I'm not right on any of these. And first I'll talk about, number one, you need to change positions. It doesn't matter if you're sleeping, whether you're in the lazy boy, a very orthopedic chair, you need to change positions. And then the second one I go in to is I say, this feels like the pain is more of a deep pulling tightness, maybe like somebody took a broomstick and is pushing it into your spine in different areas. And you feel that if you could just kind of get two John Deere tractors, one hooked up to one end of your body and the other one hooked up to the other end, and they could kind of pull you apart, but at the same time maybe just twist it just right to get that terrible pulling pain out. But that's your predominant pain. Now that pain can become sharper at times with no activities. it can become, actually into a more of a searing, poking pain. But your predominant underlying pain is this pulling, strong type of aching, deep pain that is only temporarily relieved with change of position, braces, whirlpools, massages.
Adjustments.
Chiropractic osteopathic treatment helps, and it takes some of the edges off, but it doesn't really totally change it around.
It doesn't really last. Bill, we're going to interrupt you for just a second now. It's about 20 past the hour here on Star 790 KBME with the best medical updates ever. Let's pause briefly for this word from one of our sponsors, Magnetico. Would you like to sleep soundly and feel better, have extra energy? If so, you need the Magnetico Sleep Pad. Blind studies have found that the Magnetico Sleep Pad helps people who suffer from pain, fibromyalgia, angina, fatigue, and pain from diabetic neuropathy. Sleep Pad owners report relief from arthritis pain and back problems, migraines, high blood pressure, and other disorders. And here's the good news. Magnetico offers you a 6-month satisfaction guarantee. So start feeling good again. Call this toll-free number now, 1-866-465-8892. That's 1-866-465-8892. Remember, Aquarians are celebrating January 20th through February 18th. This is their age. And the February birthstone is amethyst. The February flower is the violet. The countdown is on. 1 year from now, we'll celebrate Super Bowl 39. How about them Houston Texans? And we're joined again by Dr. Bill Faber, my doctor from Milwaukee, Wisconsin. And we were talking about that deep toothache that happens inside other parts of your body where you just can't get at it, and we'd love to get relief.
Yes. Did you have common symptoms that these people with spinal instability can identify with that tends to go past other practitioners? Because I know you've been to various prestigious institutes and you tell them these things, but now having a thorough understanding of the mechanics and the repair mechanisms of reconstructive therapy, these symptoms have a new meaning to you.
Oh, absolutely. One of the things that I used to describe, and I was always told was, I was pressing on nerves, were these radiating pains, the pains that start in my back and go down my legs, or start in my neck and go down my arms. And they would say, well, you're obviously pinching on a nerve. And I was young and stupid and hurting. And as far as I was concerned, that was a good answer. But that's not always true.
Correct. But as you know, that your chiropractic osteopathic a lot of times could do significant things towards those radiating.
Oh gosh, yes, help that, but it wouldn't last, and that was always my concern. I've had hundreds and hundreds of chiropractic adjustments in my lifetime.
Yeah. So, what does it mean when you get relief from chiropractic or osteopathic or deep body therapies, and it doesn't last?
Well, it means we're on the right track, but we haven't gone far enough.
Right, in that our problem is unstable joints caused by relaxed ligaments, connective tissue, tendons, joint capsules, loss of disc height, loss of cartilage height through degeneration or wear and tear.
Right, and with the combination of my surgeries and my degenerative changes with my ligament laxity syndrome, I've lost 3 inches in height over my adult lifetime.
Gee whiz.
Yeah, that's significant.
That's right. I recall you telling me that in Norman.
And indeed, when, these patients come in, so common. Well, I think part of the problem is, Bill, that we're actually listening to our patients. And when the nurses are talking with them as they're getting them ready for their first office visit with me, it's funny how they come out kind of with a chuckle and say, oh, you're going to love this one. And they'll tell me what's wrong with the patient who has seen all these specialists. And it's funny how obvious it becomes when you actually have the explanation that puts it all together.
Correct, and that's, by the way, that is carefully engineered and drawn out in the first 8 chapters of Pain, Go Away.
And in a most
describing the low
beautiful
back
way.
pain.
Most beautiful. And then you go on and you describe each joint area and give specific details for those areas.
Well, that's part of Dr. Morton Walker's journalistic skill in having the book, a medical book, read like a novel and explain it to lay people in such a fashion where they get actually more tooled up, so to speak, than most physicians on what the problem is and how we repair it and why we repair it in that fashion.
Right. Well, I always say that you're always down on what you're not up on, and if the doctors haven't studied it from this perspective, they honestly don't know the answers that the patients end up knowing by reading Pain, Pain, Go Away.
Well, unfortunately, we know they haven't studied it from these perspectives.
Right. Well, we weren't taught this in medical school.
No, we weren't. And why weren't we?
Well, because it's not as profitable as drugs and surgery.
Well, that's, when I first heard that way when I was a student, I couldn't quite comprehend fully until actually years later why I actually came to agree with those statements.
It does sound kind of cynical and skeptical and such, but there's a deeper rooted truth in it.
Well, the deep truth of it is that I think the easiest way to find that there is truth to it is to simply get a quarter statement of any of the leading pharmaceutical companies. I don't care which one, and look at the different lines, and you can see that up to about 60% is sales and marketing. So 60% is spent in creating material and their promotional team and advertising. 60% of every dollar that they bring in is spent on promoting that. So it's a tremendous marketing machine.
Right.
And we know that they bring in anywhere from professional ball players to have pictures with doctors. They have dinners with the doctors, banquets with the doctors. They bring in all sorts of little stuffed dogs and all kinds of things.
Sure, and they have movie stars on TV.
Catered lunches for the staff, and on and on and on to push their products. And the price, the reason why pharmaceuticals are so high is because 60% of it has to pay for that,
right.
that marketing. And frankly, with things like that you discuss on your program, there's rarely any marketing money behind it. It's just the enthusiasm primarily of practitioners like myself, yourself, and our other colleagues from Dr. Atkins, one of the finest, who unfortunately passed away last year, Dr. Julian Whitaker, Dr. Bruce West, and many others, that Dr. Bob Rowan and
Dr.
others.
Jonathan Wright.
Dr. Jonathan Wright, and Dr.
Gosh, the list goes on and on if we start
Dr.
doing
Sherry
that.
Rogers,
Right.
Dr. Day out there in San Francisco, on and on. But the only promotion we have is basically our own enthusiasm.
Right.
And we don't have any sales force. We're fortunate that our enthusiasm carries over to books and tapes and public seminars, but
just helps get the word out.
We don't have any comp dinners for anybody. We don't have any pens that we give away or whatever.
Gee, we need to start charging 10 times and
10 times the fees that we are.
And go ahead and pay for all of this.
Well, no thanks.
You know what? The greatest satisfaction in medical practice, and you really never got much of a chance to do this because you very early got onto reconstructive therapy, and it was 12 years later for me. But the satisfaction of having people hug you and say, thank you for putting me back in my life. Thank you for helping me get on without the pain. Thank you for me not having to learn to live with it anymore.
Thank you for bringing that up, but it's January now, and what did I get this Christmas? But I got letters, Christmas cards from people putting notes in that we've treated years previously, saying thank you. My foot is still good to this day, and it's been 10 years or longer that I've treated these people, and they just are so kind to send a little note telling me that they're still doing well. I haven't seen them in years. That is not the type of pharmaceutical product that they want to develop.
Oh, not at all.
They want to have something that you take once to 3 times a day forever.
I had a fellow who was a brick mason come in, and he had a problem with his shoulder. He couldn't reach his hand back even to take his wallet out of his pocket, and that's not good for a brick mason. And we treated him 8 times. He got dramatically better. We expected him to come back. He didn't. We saw him years later because he said, well, my low back is a little bit of a problem. I said, how's your shoulder? He said, oh, it's great. No problem. So we'll be right back with you, Bill. It's now about 30 minutes past the hour here on Star 790 KBME, the best medical updates ever. Sometimes, especially when our attention is focused on our health problems, we forget that laughter is the best medicine. So try this one on. An artist asked the gallery owner if there had been any interest in his paintings on display at that time. I have good news and bad news, the owner replied. The good news is that a gentleman inquired about your work and wondered if it would appreciate in value after your death. When I told him it would, he bought all 15 of your paintings. That's wonderful, the artist exclaimed. What's the bad news? The man was your doctor. Okay, the second week of February coming up, Child Passenger Safety Awareness Week. I mention this because, as you know, we feel so strongly about wearing seatbelts. February is Heart Month as well as Friendship Month, so make a good friend, and you might find that that helps relieve heartache all around. You know, I'd like to remind you how much the show depends on you to share your questions and ideas with me. What topics do you want to learn more about? What diseases, tests, and treatments, and what nutritional supplements? Over the past 24 years, I've developed and improved integrative treatment programs to help many people suffering with frustrating illnesses, fibromyalgia, chronic fatigue, migraines and other headaches, rheumatoid arthritis and lupus, hypoglycemia, diabetes, syndrome X, heart disease even after surgery, and especially congestive heart failure, shortness of breath, restless sleep or insomnia, poor circulation and leg pains, poor memory, even Alzheimer's and other dementias, ulcerative colitis and other gut problems, frustrating skin conditions, disabling neck and back pains, as we're talking about today, sports injuries and arthritis, prostatitis, chronic urinary infections, chronic sinus and lung infections, and so on. And, you know, the list just sounds like a laundry list, but once you get to the root of how people are going wrong on the inside and it's showing up in all these different symptoms, then you know what? You can fix so many of them so easily. So what disease problems would you like to know more about? What books do you want reviewed and what authors interviewed? You know, many of the leading authors and newsletter editors in preventive medicine have been personal friends of mine for years, like Dr. Faber. What questions do you want answered? You know, in my 25 years of practice, I've become acutely aware that very few people know that simple, effective, and cost-conscious solutions are available to help with their problems right now. And few people realize that several of the problems for which they're seeing different specialists are often related to the same basic cause. For example, heartburn and belly pains might be due to medications taken perhaps over the counter or with prescriptions for joint discomforts, leading to more prescriptions for these, quote, new problems, none of which might be needed at all, simply by restoring better joint function and thereby reducing pain with reconstructive therapy. So correcting what is causing one problem might well give you improvements for several of the problems that frustrate and worry you. You've heard the saying that there is no free lunch, but we've pioneered a way to make your feeling better much more affordable for you. Make your healthcare investment pay even bigger dividends in your future. Get details on our exclusive and unique cashable voucher program that can return to you cash dollars for your future expenses. We're here to save your health and save your wallet as well. And that's what this show is all about, and that's what we're all about at Life Celebrating Health in Humble. Feel free to ask for a consultation with one of our treatment assistants. No fee, no obligation. Just dial 1-800-FIX-PAIN. That's 1-800-FIX-PAIN. You're listening to Feeling Better Naturally with Dr. John Trowbridge. And remember, we depend on you to invite your family and friends to tune in and join us here on Star 790 KBME for the best medical updates ever, Saturday mornings from 6 to 7. So, Bill, let's get on with our discussion. We're here with Dr. Bill Faber from Milwaukee, Wisconsin, talking about reconstructive therapy for joint pains, arthritis, sports injuries, and so on.
Yes.
We were talking about how we really don't have a pharmaceutical market to plow because we get people permanently better.
Plus, we don't have a hospital market either.
Yeah, that's a frustration. We should do something like that, don't you think?
Put people in the hospital?
Yeah. We've been there, haven't we?
Been there, done that, no thanks.
That's right. Yeah, I spent too much time, even though my last operation was one of these modern miracles using the surgical microscope and in and out and very little discomfort compared to 20-some years ago. I can tell you, I'd sure want to pass on that and do our treatment instead.
Well, as you know, there is a place for orthopedic and neurosurgery, but Unfortunately, it's done way too often, and the big thing that we see, personally and professionally, is that it's oftentimes not effective.
Right.
And that's where reconstructive therapy comes in that I'd say 20 to 30% of our patients have already had surgery. Another 20 to 30% of the patients I see have been told to have surgery but decide not to have it.
Which is oftentimes a better choice for them.
Yes, and then the other 30% is basically told that they're not a surgical candidate, but they've been through the physical therapy, all the drugs, the cortisone shots, and other things that have not been effective for them. And so that's about over 90% of our patients are in one of those categories or more. And the thing is that since reconstructive therapy works like a lock and key to restore your own natural anatomy, proven, it's the only proven therapy to restore your own natural anatomy by microscopic human studies, by animal studies, that it is actually the crown prince of all musculoskeletal treatments, because no other treatment can say they can make you a better, stronger, permanent you other than reconstructive therapy, because they just simply do not have the ability to make the new tissue as we do.
Exactly. We're turning on body systems to actually do the repair that your body would do if those tissues were, more normally supplied with blood. The structural tissues, the rubber bands, can't have a good blood supply because they'd be constantly breaking those blood vessels. And so there's a limit to the healing you do after an injury. And we simply trick your body into thinking that you had a new injury, so you need new healing.
Correct. Basically, after an injury or when your wear and tear gets too severe, after about 6 to 8 weeks of what is called conservative therapy, meaning massages, maybe bracing, physical therapy, maybe orthodox drug therapy, if you're not better in that period of time, most likely you're a candidate for reconstructive therapy.
Oh, yes. And most likely, 9 times out of 10 or so, you'll be thrilled that you did it.
Well, that's for sure. We have got, over the years, we have a number of people that had 50 years of suffering resolved with reconstructive therapy.
Oh,
so
right.
It doesn't matter, no matter how long you have had the problem.
Right.
That is not a limiting factor.
Right, or no matter how old you are.
And that's correct, too. We hope to be able to treat somebody in their hundreds. We've got a number of people in their 90s, but I haven't got any 100-year-old people that I've treated yet.
The 90-year-olds, one of our patients was 94. She was the mother of one of our long-term patients, and he brought her down because she had fallen and broken her hip and been repaired. And I said to her, "What is it you would like for me to do for you?" And she says, "My knee hurts." And I said, "Well, I got that part, but what do you want as a result out of all this?" She says, "I want to go home and live by myself again." And sure enough, after just a few treatments, we were able to send her home. She spent another 2.5 years by herself again, starting at age 94.
Well, as you can see, that's an ideal type of patient. It's the patient that wants to do things with their life. That's why we titled our book together, is Do What You Want to Do. This therapy allows you to actually regain your life and do what you want to do. One thing I notice, every day we see the benefits of our learning this therapy and learning more about it and doing it. I had a gentleman from southern Indiana towards Indianapolis today, and his last treatment was in November. I said to him, "How was your treatment in November?" He says, "Well, it was really kind of hard to tell because I went right home and I dug 13 fence posts." I said, do you have a power auger?" He says, "No, I dug these by hand."
Oh, boy.
So the point is that
that's what he wanted to do.
System, as we were trained in school, we're trained to give these people the devil and say, "Now, John, you know that you can't be doing that with your back. You have to cut back." With this therapy, we just kind of laugh and say, well, we've got to get ahead of it so that you can do that. And he didn't really have much problem doing it. But we have to get ahead of the whole problem so that he doesn't need me anymore.
How true that is. Bill will be right back with you. It's now about 40 past the hour here on Star 790 KBME, the best medical updates ever. We sometimes forget that spiritual centering is an important part of healing, getting better and staying healthier. Today's verse is from Proverbs chapter 4, verses 20 through 23. My son, pay attention to what I say. Listen closely to my words. Do not let them out of your sight. Keep them within your heart. For they are life to those who find them, and health to a man's whole body. Above all else, guard your heart, for it is the wellspring of life. We're happy to continue our discussion this morning with Dr. Bill Faber of Milwaukee. And we were talking about just, getting our patients on the go. It really is true. I mean, people come into us limited, and they leave excited.
Well, remember, as I was telling you with our traditional training, that like with this one gentleman, they go and do heavy activity, and they say, well, John, you shouldn't be doing that. Another one is that the medical profession teaches, they say, well, John, at your age, you really need to cut back.
Right.
I hate that. Or, what you should do is get one of those little scooters for $1,000, $2,000, $5,000, or get one of those. We'll have you get one of those little elevators that go. Those things cost from $6,000 to $10,000 to go from your basement to your first floor.
Right.
Type of a thing. Whereas with this therapy, we just have to guide the patient into getting enough therapy so that they automatically regain these abilities.
Exactly.
And you don't have to have any of these gizmos, as I call them, or paraphernalia to do it. They just take off and do it.
Well, I tell people we don't want you to be a couch potato while you're getting these treatments. We want you getting on with your life, and exercise is great, but let's discuss how you're going to do it, and let's do repetitions, not resistance. Let's do motion, not mass. Don't try to overstrain. Just gradually build up, and that happens.
Exactly. It's really quite simple on that for the vast majority of people. We just say, well, as you feel better, you can take on more. But remember, it's just like, stand before you, or crawl before you stand before you walk, and walk before you run.
Right.
If you decide that you took on too much by doing 13 fence poles, well,
cut
back to 5. And as we go on, we expect you to get to your full complement of 100 fence poles, whatever they're supposed to do.
Oh, that's a Texas-size ranch.
Right.
I tell people that you have to be wary because you can hurt yourself while we're doing your treatments or afterwards. You can hurt yourself just like regular people can. And the place where I find commonly this happens is folks drive to a shopping center. And they're so excited because, they're going on with their life, and they're thinking about all they're going to do and the list that they've got, stuff to pick up and whatever, and they trip over those concrete things that are put out in a flat parking lot because people, for some reason, can't figure out how to park a car. And sure enough, we get people who come in, they tripped on that, they tripped on some curb or something because they no longer were watching out to guard themselves. They were getting on with their lives.
They're kind of running, in other words.
Yeah, basically.
I find that in the winter of 2000, in December alone, we set a record of 50 inches of snow in the Milwaukee area.
Whoa!
And my patients come from regional and nationwide, as yours do. And we had 5 patients have very significant car accidents in that winter.
Whoa.
And they would roll their SUVs and have totaled their cars. And all of them had spinal therapy and significant spinal therapy before they were in these accidents, and not one of them reported a worsening of their spine problems. And so it's not only does it provide optimal strength and function, but it also provides prevention from further injuries.
Right.
So they get super joints.
They get stronger than they were before.
Well, the studies show that they can get up to 140%. So they can get up to 40% stronger than they were at their best point in their life.
Before they ever got injured.
Correct.
Right.
And this, you hear it particularly with ankles after you strengthen their ankle. I hear so many people that they say, I would trip on the smallest pedal, and smallest pebble, and I would turn my ankle over as a result of that.
Right.
I'd have to constantly be watching. Now, I don't have to think about it. I'm just on automatic.
That's just so great. Dr. Bill Faber, we're going to come right back with you. I want to talk when we do about neural therapy, neurofascial therapy. It's now about 45 past the hour here on Star 790 KBME, the best medical updates ever. For your better health, I'd like to share with you this special announcement from our sponsor, Magnetico. Would you like to sleep soundly, feel better, and have extra energy? Dr. Dean Bond-Lee wrestled with these problems and came up with his wonderful invention, the Magnetico Sleep Pad. Scientific blind studies found that the Magnetico Sleep Pad helps people who suffer from pain, fibromyalgia, angina, fatigue, and pain from diabetic neuropathy. Sleep pad owners report relief from arthritis pains, back problems, migraines, high blood pressure, and many other diseases and disorders. You may think that the Magnetico Sleep Pad is too good to be true, and it certainly sounds like it, but Dr. Bond-Lee wants you to be completely satisfied. So Magnetico offers you a 6-month satisfaction guarantee. That's right. Instead of 6-month satisfaction guarantee, start feeling good again. For more information on the Magnetico Sleep Pad, please call this toll-free number now, 1-866-465-8892. That's 1-866-465-8892. Today's celebrity birthdays, February 7th, author Charles Dickens, born in 1812, author of Tale of Two Cities and wonderful others. And of course, on February 8th, the Boy Scouts of America were founded in 1910. Also on February 8th, actor James Dean, 1931. February 8th, author and futurist Jules Verne was born in 1828, and news commentator Ted Koppel, born on February 8th in 1940. We're back now with Dr. Bill Faber from Milwaukee, and we're going to talk just briefly about another aspect of the kind of care that you have taught me, and that's called neurofascial therapy, instant pain relief.
Correct.
And that's the name of your book.
Correct, also with Dr. Morton Walker. Neurofascial therapy is, the Germans discovered it, the Hünecke doctors in Germany in the 1920s, and finding that local anesthetics applied to and around nerves and other tissues could provide instant and permanent relief of chronic pain conditions. They discovered this with their sister who had severe debilitating migraines, and they applied the neural technique to the base of her skull and got what they call a lightening. A lightening is defined that the symptoms and function return for 24 hours, for at least 24 hours.
Right.
And there might be some residual at that time, but a lightening is that the symptoms and function is resolved or very dramatically improved for 24 hours. In the case of dental pain, 8 hours. Now, remember the local anesthetics, the drug effect, which we're not talking about, or the anesthetic effect, is only about an hour for the ones that we use.
Right, or at the most, a couple of hours.
Right.
And it doesn't give the significant and startling response that lasts and lasts and lasts.
Right. What we're interested is restoring the bioelectric charge that is normally within nerves or within cells or within cells' walls or within red blood cells or the tissues. When it gets injured, that bioelectric effect becomes what they call depolarized, and it's like the alarm firing off all the time. That's the pain.
Right.
And so we want to, how local anesthetics work is by restoring that normal membrane electrical charge, and that's what we do one way. Now, in my book, we renamed it because we felt that there is as much osteopathic effects to neural therapy as the nerves. And there can be many conditions where we feel that the tissue is matted or tightened down through oftentimes injuries, infection, surgery, falls, deliveries, forceps or non-forceps deliveries can be very traumatic.
I like the example you use in your book. If you put a piece of tape on a balloon that's already blown up, it doesn't affect the balloon at all. But if you put the piece of tape on the balloon before you blow it up, it puckers right there. And that puts stress lines on the balloon, and that's certainly what you're talking about, these electrical stresses in the cells and the tissues.
Right. The electrical, when the electric fires off, it puts a tightening on the tissues. But also, if you patch a balloon, it will put stress
right at the spot there.
On the area remote from that patch. Also, it doesn't have to be at the patch area.
That's right.
And so we have treated people many times, let's say in their head or in their chest or abdomen, and have relieved their shoulder pain or their foot pain. One coming to mind right now is a lady that came to me some years ago that was complaining about her feet so badly, and that they were going to get a van because they're in retirement age or a mobile home and travel around so that she could lie around in the back, and then her few steps that she could take, she could enjoy type of a thing. When I looked at her feet, I didn't bother to x-ray them because when I examined her feet, I said, these are good feet. And then I went through a history of all the injuries that she had, and I still didn't reveal any clues, and so I started searching her cranium. And when I felt the scalp, I could feel this roughening, this tightening. And I said, what happened here? She said, nothing. I said, no, this is not right. I kept rubbing on it. I said, this is not right. And she was kind of flinching a little bit while I was rubbing on her scalp in a nice method where most people will say, you could quit that in about 2 hours. She was not liking it. I said, what went on here? It was more in the frontal area of her scalp. I said, it's roughened. It isn't right here. She said, well, then it clicked with her. 20 years ago, I had a head-on collision and went through the windshield.
Nothing.
I said, okay. Well, these people tend to recover from it as far as they know. But years later, through just the stress of daily routine, this was acting as an anchor, and it was pulling all the tissues of her body tight, and where did it affect her? At the other end.
Right.
So what I did was the neurofascial therapy to reset the nerves, to relieve the tissue tension, and that was it.
And she got better.
Not only better, instantly better. I think we did it. You have to chase it out. A lot of times there's a residual. We chased it out 2, 3, 4 times. That was it. End of story. End of treatment. End of Dr. Faber. She's on her way.
And we're talking really tiny injections, just like the dentist uses to put a portion of your jaw to sleep. We're talking about very fine-tuned injections.
Yes, with very small needles, and actually they're much more comfortable than the injections the dentist.
They really are, aren't they?
Well, absolutely, as I've had them for my head injuries, and of course I've had my share of dental injections. I'd take the neurofascial any day.
Any day of the week. Bill, we've got a couple minutes to sum up. What would you like for people to remember about your career of treating patients with RT and neurofascial therapy?
Well, I'd like them to, call your clinic and get a copy of Pain Go Away. If they have any musculoskeletal conditions that they're tired of taking medicines for, that they've had surgery, that they haven't resolved from, if they have a lack of endurance or a pain problem in any of their joints, because it covers all the joints permanently. And I wrote the book. I've never made 1 penny in royalty from the book. I wrote the book simply to get it out there to help people that haven't been able to find relief. And so that's my main message. And also that it helps the widest majority of musculoskeletal conditions. The most common problems with the foot, the knee, the hip, the back, the fingers, the
shoulders, the elbows, the jaw,
neck. The neck. It helps all the joints in the widest variety of conditions. I guess basically it's shorter to say what conditions it doesn't help. Well, it doesn't help malignant disease, problems caused from cancer. It does not help rheumatoid disease. It does, but you need to fix the causes of rheumatoid or the inflammation, the biochemical and the toxicity elements. Doesn't help gout. You need to fix the biochemical elements. It's not for people that are too sick to have the therapy.
And too sick to do the healing from it.
Too sick to do the healing from it, but basically it helps genetic conditions that people that have the deformities that have been told that it's helpless to do anything more. It is really a godsend to people in really just as many as I was helped right away. You noticed yours was helped right away, but some conditions and different people have different healing rates. But generally within 12 treatments, people can notice for themselves without any x-ray that it's doing deep, lasting improvement to their body. And once you get enough treatments, the results are permanent. There's no downtime. It's proven in double-blind studies to be effective. It's safer than a shot of cortisone. It's safer than a shot of penicillin. There's no prescription medicines required, at least 95% plus of the times. And it's wonderful. It's given my life back, and it's given many people's life back. And I appreciate the ability to know you and to share once again on your program.
Thanks so much, and we have to have you back. You'll agree?
Absolutely.
Thanks so much for joining us today. Dr. Bill Faber of the Milwaukee Pain Clinic. And we sure do appreciate your joining us this morning. You know, you've summed it up. Arthritis problems. Some of them are disease-related, as you've named, and most joint discomforts are wear and tear arthritis or so-called degenerative joint disease, whether it's from sports injuries or other daily life injuries. It's the wobble that grinds down the tissues. And pain motivates people. It's not the spurs that are the attempt of the body to fuse the joint so it stops wobbling, but pain is the motivation. As long as you can move it, it's likely that RT can help. And don't forget the neurofascial therapy for scars and other compression and other injuries for greater comfort. Hope that help is really available now is the key thing, because it's never too late to find out what healing God really has placed within your reach. For more information, Dr. Faber's books, Pain, Go Away, and Instant Pain Relief, and our joint book together, Do What You Want to Do, they're all available by calling Life Celebrating Health. Roberta from Houston emailed and says, what do you do about being sick and tired of being sick and tired? So tune in next week for some Valentine ideas. Feeling better is the sweetest gift of all. You want more energy and better sleep, better memory? You want to feel stronger with more endurance? Join me next week. This show today is dedicated to people everywhere who have suffered long enough with pains and limitations, whose lives have slipped slowly away as they sit or stay close to home, too uncomfortable to think that anything could help besides more surgery and more drugs. God's healing is available for all of His children if they only open their eyes and reach out. Our production engineer today is Mark Fisher, production assistant Catherine Hill. Thanks for joining me today to learn more practical pointers that can help you to regain and maintain better health. Audio tape and CD copies of this show are available for your personal reference and to share with family and friends. Simply call 1-800-FIX-PAIN for details. I invite your feedback. What do you want to hear more about? What questions do you want answered? And who would you like for me to interview? Share your ideas by email. That's info, I-N-F-O, at healthchoicesnow.com. By fax, 281-540-4329. By mail, call 1-800-FIX-PAIN for the address. Or feel free to call and talk with one of our treatment assistants and let us know what you want to hear about or what information we might send to you. Receive our free e-newsletter simply by sharing your email address with us. And enjoy the free downloads available on our website, www.healthchoicesnow.com. Feel free to come by to see what's so special and visit with patients who are feeling better right now. They're anxious to share their successes with you in person. We're next to the Northeast Medical Center Hospital near Bush Intercontinental Airport. Call 1-800-FIX-PAIN for directions or a map. We'd love to show you where better health happens. Remember, if your money, your time, your effort, your comfort, or even your life is at stake, get the very best answers and the very best treatment you can find. Rely on experts who can make sense out of your problems, who have the experience to produce results for you. When life is your choice, failure is not an option. And our message is one of hope for a healthier future, and we aim to produce these results for you. Invite your family and friends to join me next week, Saturday morning from 6 to 7 a.m. on Star 790 KBME for the best medical updates ever, exclusively on Feeling Better Naturally with Dr. John Trowbridge. Have a great day and a wonderful week.